Canine parvovirus, also referred to parvo, is a contagious virus mainly affecting dogs. CPV is highly contagious and is spread from dog to dog by direct or indirect contact with their feces. Vaccines can prevent this infection, but mortality can reach 91% in untreated cases. Treatment often involves veterinary hospitalization. Survival rate depends on how quickly CPV is diagnosed, the age of the dog, and how aggressive the treatment is. Treatment usually involves extensive hospitalization, due to severe dehydration and potential damage to the intestines and bone marrow. A CPV test should be given as early as possible if CPV is suspected in order to begin early treatment and increase survival rate if the disease is found. Dogs become infected through oral contact with CPV2 in feces, infected soil, or fomites that carry the virus. Following ingestion, the virus replicates in the lymphoid tissue in the throat, and then spreads to the bloodstream. From there, the virus attacks rapidly dividing cells, notably those in the lymph nodes, intestinal crypts, and the bone marrow. This form is less common and affects puppies infected in the uterus or shortly after birth until about 8 weeks of age. 2. The virus attacks the heart muscle and the puppy often dies suddenly or after a brief period of breathing difficulty due to pulmonary edema. Prevention is the only way to ensure that a puppy or dog remains healthy because the disease is extremely virulent and contagious. Appropriate vaccination should be performed starting at 7 to 8 weeks of age, with a booster given every 3 to 4 weeks until at least 16 weeks of age. Parvo is a potentially fatal disease. The survival rate of dogs treated by a veterinarian is 68 to 92%, and most puppies that survive the first 3 to 4 days make a better recovery from the viral disease.